Thanks, Carla. Okay, I'm going to go ahead and get started. Hi, everybody. Welcome. Jumped ahead of myself. Welcome, everybody. Thanks so much for being here for today's training on the fundamentals of Medi-Cal and managed care and CalAIM. Don't be confused by the HIP, the Housing and Homelessness Incentive Program implementation there on this slide. That's the sort of context with which this training came out. Homebase is working with Santa Clara Family Health Plan to help support the community's HIP implementation. And as part of that, there's lots of different pieces, lots of connections to other healthcare resources, including CalAIM and managed care. So that's just the context for where this training is coming from. And I'm really happy. My name is Jillian Marchetti. I'm with Homebase, and I'm really happy to be here helping to do this training and help moderate it. I'm going to launch in a second, but also just wanted to let you all know that in addition to Homebase putting on this training for you all, and really appreciate you all taking the time to be here for this, we also have representatives from all three managed care plans, Medi-Cal Managed Care plans, who operate in Santa Clara County. And so you will be hearing from each of them, as well as me, as we go through these fundamentals of Medi-Cal and managed care and CalAIM. So we also have, I have my colleague Carla, who I'll give a wave on the call as well. She'll be keeping an eye on the chat and helping to moderate questions. We will have plenty of time for question and answers from folks, both like at various points during the presentation, and then at the end of the presentation, we'll have a larger period of time. So feel free to put questions in the chat as they occur to you, like during the presentation. And we'll, if it makes sense to answer a question, like in the moment, we'll pause and take questions as we go. And for some questions, we might save them for the end for the Q&A, like the final Q&A portion. So, but as they occur to you, feel free to throw them in the chat. Also, if you're having issues, if you just want to be in the chat, introducing yourself to each other, discussing anything that we're talking about, feel free to use the chat that way as well. And as Carla just mentioned in the chat, we don't have a link to the slides right now, but we will send them out after the fact, and we are recording this training, so it'll be available to folks afterwards as well. So with that, I'm going to go ahead and get us started. So just a little bit of context setting for the training today, and then I'll kind of go over the agenda. There is, I think, hopefully folks on this call who work for the CoC and are working with folks experiencing homelessness. This isn't a surprise, or no one would disagree with this, but we know that housing is a social determinant. Sorry, trying to move my slides and I'm flipping through them. We know that housing is a social determinant, a really key determinant of health, and vice versa, that healthcare access is really critical for folks to be able to secure and maintain housing. And so because of that, supportive housing system and health system collaboration is really, really critical. So especially, that's true generally. And in California, especially the last few years, we have a lot of new health system resources, including new Medi-Cal resources and other state initiatives. I mentioned the Homeless and Housing Incentive Program on the first slide, have created really incredible opportunities for cross-system collaboration and partnership between the health system and the supportive housing system. So in that context, the supportive housing system and the three local Medi-Cal health plans have all been working together, are really committed to strategically collaborating and supporting so that we can better serve folks experiencing homelessness in Santa Clara County, making sure they're connected to both housing and healthcare resources. That said, that kind of effective cross-system collaboration and partnership, which is already ongoing, I'm very happy to say, in Santa Clara County, really is helped along by cross-system education. So that's where this training comes in. We did a similar training for some managed care plan staff and ECM and CS and community supports providers. That was all about like fundamentals of the homelessness response system generally and in Santa Clara County. So this is the flip side of that. So this is part of an effort to make sure that folks in either system are aware of the sort of basics of how the other system works to help, again, facilitate this collaboration that we're trying to make happen. So with that said, today's training agenda, we're going to provide some basics of Medi-Cal and managed care, just sort of some like very high level fundamentals of Medi-Cal, as well as what managed care is. I know some of you might be familiar with some of these concepts and some may be less familiar. So hopefully we'll have some helpful information for everyone. We'll talk a bit about managed care funding, and then we'll really spend most of the time focusing on what Medi-Cal healthcare delivery actually looks like in Santa Clara County. So again, I'm really thrilled that we have representatives from all three Medi-Cal managed care plans here to present to you as well. So I'll be providing the information that's sort of about the sort of like overviews of Medi-Cal and managed care, and then we'll get to hear directly from the health plans on the information that's specific to them. So when we get to the portion about like what it actually looks like in Santa Clara County, again, we'll hear about which the managed care plans that are operating in Santa Clara County and how their provider networks work. We'll talk about the actual services and benefits that are most relevant, and specifically including the CalAIM housing related benefits, some of which many of you might know more or less about, but maybe hopefully the terms are at least familiar, and those are enhanced care management and community supports. And then finally, we'll talk about actually like eligibility for these resources and how to support folks to actually enroll and access these services. So that's our agenda for today. Again, as we're going through the presentation, feel free to ask questions, put them in the chat. You can raise your hand if you have a question that feels very urgent, like if you're not understanding a certain concept. I'm happy to be interrupted as I'm presenting. And again, you'll also hear from a few other folks who I'll introduce. Actually, I'll just I'm going to let you know who they are right now. So we have Andrews, and they can kind of wave, they'll be able to introduce themselves later. Andrew Samara from Santa Clara Family Health Plan. We have Rebecca Samaha from Anthem, and then Kristen Kane from Kaiser Permanente is here. Oh yeah, I was flipping through to see if I could see her. Hi, everyone. Thanks again for being here. And again, you'll get to hear from them directly, and they'll be able to introduce themselves in a little bit. So I'm going to go ahead and get started with the first portion of the agenda, which is an overview of Medi-Cal Managed Care. So just starting with some fundamentals about Medi-Cal. Some of this might be familiar to some of you, but not everyone. So we wanted to at least have some level setting, even though some people might know some of these concepts. So Medi-Cal is, of course, what California refers to, how they refer to their Medicaid program. And Medicaid, for anyone who wants a refresher, isn't kind of clear on what Medicaid is specifically. It is a public health insurance program that's specifically to provide coverage for people with low incomes, including families with children, seniors, folks who have disabilities, or foster care, pregnant women or pregnant people, and people with certain diseases or illnesses. So obviously, if we're thinking about folks with low incomes in California, with the way the Medicaid plan is set up, that covers vast majority of folks who are experiencing homelessness would be, Medicaid would be relevant for them. And we'll talk a little bit more about the eligibility in a bit. A couple other just basics to know. Medicaid is a federal program, so there are federal guidelines that apply to it, and policies and regulations, but every state gets to define certain aspects of their Medicaid plan, including who's eligible for it, some of the scope of services that are covered, and how kind of payments and providers work. So a few things to know about sort of how it works in terms of services have to be medically necessary in order to be covered by a state's plan. Beneficiaries have to have a choice of providers. And again, you'll hear from your Medi-Cal plans later about how their provider networks are set up. And every state has an agency that oversees their state's Medicaid program. And for California, that is the Department of Healthcare Services. I know there are lots of state level agencies with lots of similar letters in their acronyms. So I just wanted to state clearly that if you're looking for information for the state Medicaid agency, that's Department of Healthcare Services, or DHCS. Right. So in terms of managed care and what that term means, again, I think this is another term that a lot of people hear and some people know a little more about it than others. So the default delivery system for Medicaid, across the country, is what's referred to as fee for service, which is essentially meaning that state contracts with healthcare providers and they get paid a certain fee for any coverage service they provide. So it's a payment per service rendered. Managed care is essentially an alternative to fee for service, and so what it essentially looks like is the state, so California would contract with managed care plans, and then those plans would then contract with providers to actually deliver the coverage services. And rather than getting paid a certain amount for every service delivered to a Medicaid enrollee, instead the managed care plans get a certain per member per month rate for all their members from the state, and that's meant to cover all the different services and benefits that the plans are required to offer and provide cover for their members. So it's an alternative again to sort of getting paid per service per person. It's a one per member per month rate for each eligible enrollee. So California's Medi-Cal program is a little bit unique in that it is, as of recently, essentially entirely delivered via managed care. So every county has at least one Medi-Cal managed care plan. Santa Clara County has 3. And some plans, including 2 of the plans that operate in Santa Clara County, operate in multiple counties throughout the state. And And each person who gets enrolled in Medi-Cal selects a plan or is assigned one if they don't select one. And then each managed care plan is responsible just for providing health coverage to the members that are actually enrolled with them. One more slide, and I'm going to pause for questions if we have any, just in case folks have questions about like the general sort of fundamentals of Medi-Cal or managed care. So again, this is a little bit of a reiteration that the state, so California pays each MCP per member per month, a fixed rate to provide the services that Medi-Cal enrollees are entitled to. Just to note that Medi-Cal is funded both by the federal government as well as non-federal, like state and local sources as well. So it is obviously a different, we're not going into too many details about the funding mechanisms, but for folks on the CoC side, it's obviously a very different funding structure, the way that the funding happens for Medicaid. I'm going to pause there just to see if folks have questions so far. We'll pause a couple times. That's sort of, if you remember back to the agenda, this was sort of the first section, and then we're going to shift into what this looks like in Santa Clara County specifically, but I'll pause for a sec just to see if there are questions. I don't see any in the chat, but if anyone wants to come off mute or raise your hand, you're welcome to ask a question if you have one at this point. Okay, I'm going to move us into then talking specifically about what Medi-Cal healthcare delivery looks like in Santa Clara County. So as I mentioned, there are the 3 managed care plans operating, Medi-Cal managed care plans operating in Santa Clara County. Santa Clara Family Health Plan, a local health plan, and then Anthem Blue Cross and Kaiser Permanente, both of which are, of course, plans that operate in other counties as well. And we have here just estimates of the membership of each of these plans in Santa Clara County as of January 2024, just to give folks a sense of like the scope, the relative sort of membership of each in terms of numbers. And just another note that dual or Medi-Medi, for folks who aren't familiar with that term, are folks who are enrolled in both Medi-Cal and Medicare. Medicare, of course, being the public insurance plan that's for folks 65 and older or young people with a disability. So this is the first point where you get to hear from someone other than me. So I'm going to hand it over to each of the plans in turn, and they can introduce, our representatives from each plan can introduce themselves and talk through a little bit about what the care provision and the networks for their plans look like. So I'm going to turn it over to Andrew Samaro first with Santa Clara Family Health Plan.
Thanks, Jillian. So Andrew Samara here, Housing Services Program Manager with Santa Clara Family Health Plan. Wonderful to be here with you all. So the Santa Clara Family Health Plan, as a managed care provider, overall we delegate the majority of our Medi-Cal members to different provider networks. So what this looks like for you in terms of like working with your clients and who is actually their direct provider. So that ends up looking like Palo Alto Medical Foundation, there's Valley Health Plan, and the VNC clinics, other community clinics in the county, NEMS or Northeast Medical Services. And so overall what we do is we delegate our members to these various different provider networks to actually provide those services and benefits. And so if you're not familiar with Santa Clara Family Health Plan, it may be because your member or your clients are assigned to a provider network, and Santa Clara Family Health Plan is actually just the managed care provider. So we sort of work at the higher level, and then as I said, we delegate that down to the different provider networks. That's all.
Thanks, Andrew. So I'm going to hand it over to Rebecca from Anthem to share from their side of things.
Hi, good afternoon. Thank you so much for being here. My name is Rebecca Samaha. I'm one of the Regional Housing Strategy Program Managers for Anthem Blue Cross. And I am new to the health space. I actually come from about 10 years working in homeless service in a variety of roles. So really excited to do this training as we begin to see more collaboration between managed care plans and CoCs. So as Jillian mentioned, Anthem operates across the state. We're currently a Medi-Cal provider in 16 counties across California. You might see that Kern is highlighted there. It's not our favorite. It's just our most recent county that we're entering in. And then similar to Santa Clara Family Health Plan, we have our list of subcontracted networks as well as hospitals that we operate as the managed care plan for. And with that, I will pass it over, I believe, is it going to Kristen now? Fantastic.
There we go. Hi, everyone. Thank you so much for joining and for having us join you. So I'm Kristen Kane. I'm with Kaiser Permanente, and I've been their Housing and Homelessness Incentive Program program manager for the past 2 years or so. It's great to be with you all. So the slide that you're seeing with Kaiser tells you a bit about the organization. And we have, as you'll see on the slide, so we are serving currently 12.5 members and across the state, and we have 40 hospitals, 618 medical offices across the state. And you'll see the additional numbers of how KP serves both through health plan and hospital throughout the state of California. And one of the things that you'll hear about a little later on that's unique for Kaiser, so in addition to offering enhanced care management, community supports, community health worker, Medi-Cal benefits, we also have a network lead agency or lead entity, NLE. So I look forward to sharing a little bit more about KP's structure and how we're engaged in the community, but happy to join you all and look forward to talking with you a little more shortly.
Thanks, Kristen. Thanks, Andrew and Rebecca. Well, like Kristen said, you'll hear from all three of them again lately a couple different times, with just having me provide a little bit of context and sort of overarching information in between. So, wanting to talk a little bit, getting into now like what some of the services and benefits that are most relevant to you all in your working with folks experiencing or at risk of homelessness. So Medi-Cal, this again, the state's Medicaid program provides a core set of benefits. And you can see there's more detail about like what those 10 comprehensive services are, like a little bit more detail about the specific benefits and services that are included in the state's Medi-Cal plan at the DHCS website. And you can see a link there if you want to get a little bit more information about just like generally the services that are available. And we also, at the end of the slideshow, we have a couple different slides with lots of links to additional resources for folks if you want to learn more about any of these things, since today is, kind of a foundational high level overview. So what we really want to focus on a little bit more today is these CalAIM housing related benefits and services as the most relevant and also newest health resources available to folks, multiple different populations of focus, but including people experiencing homelessness. So CalAIM is an acronym, or I don't know if that's technically an acronym, is a shorthand for California Advancing and Innovating Medi-Cal. It's I think we can still call it new, even though it's sort of been in implementation for a couple of years now, initiative that is focused on improving the health of folks in California with particularly complex health needs. And people experiencing homelessness who have physical and behavioral health issues are among the multiple different populations of focus that CalAIM was designed to serve. And today specifically, we're going to talk, CalAIM is a pretty huge program, lots of different aspects to it or components, but we're really focusing today on two in particular that offer benefits and services to, again, lots of different populations of focus, but including people experiencing or at risk of homelessness. And those are enhanced care management, or ECM you might hear, which is a Medi-Cal benefit, which means that all MCPs, Medi-Cal MCPs across the state are required to provide enhanced care management to any eligible members. And then also community supports, which is a set of currently 14 different service types that managed care plans are not technically required, but are really highly encouraged to provide. And we'll go over those in a sec, but all three of your health plans in Santa Clara County are either currently already offering all 14 or offering 13 of the 14, and the last one will be available later this year. So I'm going to go over a little bit more detail about what enhanced care management is and then what the community supports are. So enhanced care management is really focused on care coordination, and you can see the core services here being outreach and engagement and care management, assessment and care management planning, really coordinating care. But the idea here is for folks who need services across different systems of care, that an ECM provider is meant to help support someone to actually make sure that they're aware of and connected to the array of services and benefits that they're eligible for that can help them meet their goals, to help them set their goals in the first place, and really to help coordinate across systems of care to make sure that members are actually accessing the benefits they're eligible for and can use those resources to help them achieve their goals. One thing we really want to note that's particularly important, of course, as you all know, for folks experiencing homelessness, is that enhanced care managers are required to meet members where they are in their community. So this isn't a service that someone has to come to a doctor's office for example. So enhanced care management providers can and should be meeting folks where they are. So if that's at a shelter, if it's on the street in an encampment or otherwise, or in their home if they are housed somewhere, either permanently or temporarily. Community supports. So here there are listed all 14 of the potential community support services that, again, states or managed care plans across the state are able to provide. And as I said, Kaiser's already offering all 14 of these in Santa Clara County. SCFHP and Anthem are both offering all but one. And you can see there it's the short-term post-hospitalization housing that is going live in July. So later this year, all 14 of these will be available for folks who are eligible in Santa Clara County. There are lots of different services. We could do entire trainings about each one of them individually. I'm not going to do that to you all today, but we do have, again, we have resources linked, including like DHCS has resources on this. I'm sure each of the different plans does. Homebase also has created some resources that were developed specifically for folks on the CoC side to kind of better understand these resources. And you'll see that the top 6 are in bold, and that's really just to note, like there are some that are particularly related to housing. So all of these could be, supporting or useful to folks who are experiencing or at risk of homelessness or who have recently exited homelessness, but we wanted to just make sure you're aware of a few in particular that are most related to housing and to helping folks get to a point of being able to find and secure housing and also stabilize within housing. So so housing transition navigation services, which is one very common one for folks experiencing homelessness. Housing tenancy and sustaining services for folks once they're in housing to help make sure they are able to maintain it. Housing deposits, of course, is what it sounds like, but also includes more than you might think. So again, if you're interested in learning more about any of these in particular, there's lots of information that kind of lays out the eligibility for each one of these services and what it includes. Some of them are probably broader than they seem just from the name of them. Actually, before I'm going to go back real quick. Putting them on the spot a little bit because I didn't say this ahead of time, but if anyone from any of the 3 managed care plans wants to add anything about ECM or community support specifically at this point, you certainly don't have to. I know we'll have plenty of time for questions in more detail, but okay. So this is actually pulled. Oh, Chris from Anthem. Yes, Chris, go ahead.
Hey, this is Chris Kuntz with Anthem Blue Cross.
Yeah.
Jillian, if you go back to that slide, yep, there you go.
This one?
I think it's important, like while the health plans can offer these things, right? We really depend on, local organizations to provide those services. So, like the short-term post-hospitalization housing is one that will technically go live, right? In a few months, but we're still looking for organizations to actually partner with us and provide this service. So I think that's like a critical call out. Like we don't as health plans do these things. We depend on, the network of organizations in the community to do these things. We as a health plan, we pay for these things, right? So
yeah.
And I'll just give a plug. If you guys, short-term post-hospitalization housing, if there's any homeless organizations that are, interested in offering this service, do reach out.
Actually, Chris, we had a question in the chat about whether this service in particular would be elaborated on further. And this training doesn't actually go into any of these particular community supports in great detail. Like I said, there's more detail in some of our resources, but Chris, if you did want to share a little bit more about like what post-hospitalization short-term housing actually is and looks like, especially because you're wondering if certain providers are interested in doing it, that would probably be really helpful.
Yeah, sure. I mean, Jillian, you can probably send out like the DHCS, community supports policy guide, right? And that's what we as health plans kind of use, like that. Like DHCS kind of sets like what these programs are and kind of what they include. So I'll just say, like, similar to Rebecca, I have like a homeless services background, and when I read kind of the what DHCS says on what is short-term post-hospitalization housing, I kind of look at it, it's basically a shelter bed for people coming out of some type of institutional care, right? And that could be a hospital, a psychiatric facility, a substance use treatment program. It also includes people coming out of jail or prisons, right, that have nowhere else to go. But it's it's a bed, right? A temporary housing bed that the health plans can pay for up to 6 months. And while they're there, they're receiving, a lot of the housing navigation case management services to help them transition, back into the community. So it might sound like a very kind of like healthcare like terminology, intervention, but at its core, it's a shelter bed with some housing supports for people coming from some type of institutional setting.
Thanks, Chris. And I don't know if Kristen or Andrew, if either of you wants to add anything, any clarifying to that, to what Chris said, feel free. But
no, I think Chris covered it pretty well. Just like thinking about providing support to folks that are really transferring from various institutional facilities, especially while experiencing homelessness. So one of those like critical supports that are needed in the community.
Yeah, and I'll just jump into to double click and emphasize the request. If you're a community partner that's looking or interested in offering services, we'd love to be able to connect with you and contract with you.
thanks. Thank you both. Yeah, and like I said, we'll have plenty of time for questions, and I suspect, well, I shouldn't assume how many questions folks will have, but if we have time after questions within our 2-hour slot, if folks do want to ask or talk through kind of any of the considerations around what Kristen and Andrew and Chris have just been talking about in terms of, being interested in becoming a provider of any of these, we can certainly keep space for that open. All right. Thanks, y'all. Okay, so this is a lot of words. All these slides I know are a lot of words. I am a person who does not process information audibly, like verbally, so I really need to see things in writing. So I always commit what I was told many, many years ago was like the wrong thing to do with PowerPoint, which is put a lot of words on the slides because I like to use them as handouts and references after the fact. So this slide especially has a lot because this is an image that was pulled from a DHCS resource that you can see linked there at the bottom for enhanced care management for individuals experiencing homelessness. And so this is kind of just an example of kind of meant to show, and I'll again open it back up to any of our managed care plan folks that are interested to speak to this in a second, but just kind of showing a little bit of the relationship between ECM providers and community supports providers and kind of the different services, how they can kind of work together. We haven't yet talked about the referrals, which is what we're going to do in just a moment. But one thing that enhanced care managers are meant to do is to help the folks they're working with understand, again, I mentioned all the different services and benefits they're eligible for, and that includes community support. So ECM providers can help people understand like what community supports they might be benefit from and that they might be eligible for, and then actually refer them to those and help coordinate with their community supports providers. So this is, again, kind of giving a little bit of a glimpse into what it might look like for someone to begin to receive enhanced care management, get referred by their ECM provider to various services, including potentially some of these community supports. And then you can see in the bottom right, like that might, ideally that would lead to what DHS is referring to here as the housing trio, which is the housing transition navigation services, which is includes like a housing assessment and helps develop a housing support plan for folks to like get into housing, housing deposits, which are again, like actually dollar amounts to cover housing deposits that are needed. And then housing tenancy and sustaining services, which is again, supporting someone once they're in housing to maintain housing once it's secured. I will pause, as I said I would, if Rebecca or Kristen or Andrew or anyone else from the plans wants to talk about the interrelationship between these or wants to share any specifics about like what the provision of ECM or community supports looks like for folks experiencing homelessness.
Yeah, I could just elaborate a little bit. Yeah, so I mean, just really thinking about enhanced care management as like that lead care manager. So like what DHS put out was they sort of identified these different populations of focus, and really the purpose of that was to identify who are the most vulnerable groups of people that managed care plans serve. And so obviously persons experiencing homelessness is one of those, people exiting carceral system. And so those are just some of the populations of focus. And then that ECM provider is really operating as like the lead care manager. One of the things, that we all notice as like housing providers is that, there's a lot of cooks in the kitchen. And so how can we have a lead care manager that sort of is that main point of contact for a member or a client, and then really looking at those community supports as just the additional supports, like the additional things that a person needs to be able to, achieve that optimal health, like being able to be connected to a housing deposit or being able to be connected to housing navigation and all of those other community supports that are available. So looking at it as sort of like those legs that are really necessary to help these folks meet optimal health. I'll pass that to any of the other plan partners.
Well said. Thank you.
Thanks, Andrew. Rebecca or Chris, anyone else want to add anything? Okay, great. All right, so this is just another pause point for questions. We're going to talk about actually like what the referral processes look like for connecting to these resources in a moment, but again, want to pause to see if anyone has questions about the particulars that we've talked about so far.
Jillian, there was a question in the chat that is more of a general Medi-Cal question, but about like retroactive payment if somebody goes to,
Yes.
Yeah, would you like to?
Yeah, why don't you actually hold that to the end if that's okay? But yeah, thanks, Carla, and thanks, Annette, for the question. We'll circle back to that when we do questions at the end. All right. Thanks, Carla. Okay, so we're gonna, this is our sort of final section where we're talking about eligibility and actually enrolling and accessing these services that we've talked about. And so this slide is mostly, I'm gonna be very quick on it because this is just general eligibility for Medi-Cal. Again, especially because of the income eligibility bullet in the top, the vast majority of folks that you're working with, people experiencing homelessness, are likely eligible for Medi-Cal. And although this training doesn't really cover it specifically, if you do have questions about actually like connecting folks, enrolling folks in Medi-Cal, or keeping them enrolled in Medi-Cal because there's a reauthorization process, we have a lot of resources that are again linked in the final slides to help folks get enrolled with and stay enrolled in Medi-Cal. So just wanted to note that. And specifically because, not just because it's very important for folks to be connected to Medi-Cal so that they can get coverage to, or get access to all the different services that are covered in the state's Medi-Cal plan, but also because being enrolled in Medi-Cal is one thing that you need to make sure has happened for folks to get connected to enhanced care management and community support, since they're Medi-Cal benefits and services. So in order to be eligible for ECM and community supports, you have to be enrolled in Medi-Cal and enrolled with an MCP, a managed care plan. And then for ECM, people experiencing homelessness is an eligibility, or is a special population of focus. Same with community supports, and just want to note that for each of the community supports, the specifics of who's eligible vary by community support. And so again, there's lots of, Chris mentioned earlier, the community supports policy guide, and Carla linked it in the chat, and we can send it around as well as a follow-up resource. Has a lot more details about all of this, but just kind of keeping in mind that those are all things to look at in terms of knowing what you can connect folks to. And again, if someone is connected to enhanced care management, their enhanced care manager can and should be able to help them navigate connecting to the community supports as well. So to actually enroll, again, folks have to be enrolled in Medi-Cal and select a managed care plan to receive these benefits and services. There are, I mentioned, enrolling in Medi-Cal, and we have some resources to help because this training doesn't go into the depths of that specifically. But basically, folks, you enroll via your county. There's a couple different ways you can enroll. And there's also really want to like emphasize that there are free certified enrollment counselors. So if people are having trouble or have questions trying to get enrolled in Medi-Cal, there are free resources available to help. Once someone is enrolled in Medi-Cal, they would pick a plan. If they don't pick one of the 3 plans that are available in the county, Medi-Cal will choose for you. So no one will be sort of left hanging because they don't proactively choose a plan, but you do have the ability to choose a plan once you're enrolled. And then as far as enrolling in enhanced care management and community supports, Medi-Cal members have to submit referral or application forms, as well as supporting documentation to their MCP that they're enrolled with. So I'm going to give just like very basics, a couple of slides of just like in general what that referral process looks like. And then again, you'll get to hear from each of the plans on how their referral processes work for ECM and community supports. So one thing that's really critical to know, and which is great, is that members who are eligible, folks who are enrolled in Medi-Cal and eligible for enhanced care management or community supports, can be referred by anyone, including themselves, including you all. If you're working with someone, you can support them to refer them to these resources. Community members or family members, of course, again, ECM providers can refer folks to community supports. Community supports providers could refer folks to other community supports. So it really is meant to be, as low barrier as possible to connect folks to these resources in terms of who can do the referrals. Again, you have to be enrolled in Medi-Cal already and have selected a managed care plan, because you are going to do the referral to the managed care plan that the person is a member with in order to connect to ECM and community supports. And just a few other things to note, again, very basic things, lots of details underlie all of these, but once a person is a member, is approved and enrolled, as you heard from the plans, each managed care plan contracts with different providers to actually provide enhanced care management in the different community supports. And just as to know, like, people who are enrolled in both ECM and also one or more community supports may or may not have the same providers for both. If a person, and again, we mentioned this, but just I think helpful to reiterate that if a person is enrolled in enhanced care management, that ECM provider can and should assess and refer them to appropriate community supports that they might be eligible for and that would benefit them. So this is kind of just, again, to reiterate that the referral sources there's a multitude of referral sources, especially including for ECM, but this is showed up as community supports because, of course, ECM case managers can also refer folks. But just to kind of reiterate that the different, in addition to the member themselves, the different kind of agencies and entities that can help support someone to make referrals for these resources. So that's the sort of general, like how the referral works for ECM and CS, or how the process works. But we're going to take a look at what that actually looks like in practice for each of the managed care plans, because you get referred to your plan for these resources. We want to give you all a chance to hear directly from each of the 3 plans. So again, I'm going to turn it over to Andrew to get us started to talk about SCFHP's referral processes.
Thanks, Jillian. Okay, so this is just a copy of our referral form, but I would say that the referral form is always going to be most up to date and available on our SCFHP ECM webpage. The easiest way to get to that is by doing a simple Google search. You could just type in SCFHP ECM, or if you're looking up community supports, SCFHP community supports, and it'll generally be your first result on your Google search. Otherwise, you can just go directly to our page at scfhp.com. But so the referral form in general, it should just walk you through all of the needed information as well as eligibility criteria. Some key points are just to really note that supporting documents are extremely valuable in being able to get a timely referral processed. If supporting documentation isn't available, they really encourage to utilize the additional comments in text space to add any notes regarding the member's case. So any notes that they may be looking for that are like important to this population of focus or to the member's referral would be really important. You can go to the next slide. And so just in terms of the ECM referral requirements, they must provide and indicate the population of focus that they're recommending the member meets the eligibility criteria for. So as you mentioned earlier, there's a number of different populations of focus. I guess some of the more common ones for this group would probably be the homeless population of focus. There's also the transition from institutional setting population focus, and then more recently we've been doing some work with our transition from skilled nursing facility back into the community. So if you have any members under any of those different populations of focus, only make sure that they meet all of the different criteria. And so the documentation for supporting applicable populations of focus, as I said, utilizing those comment space and providing any different types of supporting documents like case notes, medical records, attestation of homelessness, care plans, SNF transition assessments, and then any other supporting documents. And so that's all for our ECM. And go to the next slide for a little bit more about our community supports. So for our community supports referral process, again, those forms are downloadable at scfhp.com. You could also just Google SCFHP community supports, and you should be able to find it as one of the first results. I think the key points are that the email and direct phone lines for this one are for referring providers only. But one of the one of the great parts about community supports is that this is available to all members, whereas the ECM is specific to the eligibility criteria for the different populations of focus. And so members and their caregivers can actually call customer service to self-refer for community supports. That's one of the great benefits of community supports. So if you have a member and they feel like they want to make that referral themselves, they could always call our customer service to self-refer themselves into any of the different community supports that are available. And as we mentioned before, there's about 14 that are available. So definitely make use of all of them available to the members. And that's all that I have.
Andrew, could I ask a clarifying question actually, in case anyone is wondering, for the referring providers, just because the word provider I feel like is used a lot, including on the CoC side, and a lot of folks on the call might think of themselves and be providers. So can you just clarify who a referring provider would be? Like, is that any provider working with a client? Is it specifically like contracted SCFHP providers? Could you just clarify what counts as a referring provider?
I'll have to follow up on that one specifically, just because I want to make sure to give you the correct answer on that. So let me just follow up with that, and then I can touch back in a little bit later on it.
Okay, thanks, Andrew. All right, so we're gonna shift over and now turn it back over to Rebecca to talk about Anthem's referral process and forms.
Great, thank you so much, Jillian. So similar, we really try to align with our plan partners. So the referral process for Anthem is going to really mirror Santa Clara Family Health Plan. Here we have two of our referral forms, the ECM and the CS referral form. We just recently revamped these. We're trying to make them as simple and straightforward for our providers as possible. I do want to note with the community supports referral form, you're going to see all 14 community supports listed on that one referral form. You do not need to resubmit the whole packet. You can just submit the pages that are specific to the supports that you're requesting. And also really want to highlight there's going to be numbers on both of these referral forms for our care centers. And our goal is to really increase ECM and CS referrals in our communities. We're trying to screen people in, not out. So if you run into questions and you feel like you need a little bit more support with this process, don't hesitate to call those numbers on the referral guides. Next slide. So again, similar to Santa Clara Family Health Plan, you're going to have to gather necessary supporting documentation for each referral. I put a link to our CalAIM resources and referral website. But also if you Google Anthem, CS referral or ECM referral, that document's going to pop up. For the ECM population of focus, it is going to require that the individual is homeless or at risk, and that they also have like a complex behavioral or physical need. Most of your clients are going to meet this because it's including asthma, diabetes, hypertension. So the majority of clients that you're working with that are experiencing homelessness are going to meet this ECM population of focus. And then better to submit a referral and have it denied to try to get that member connected. You're going to confirm eligibility, as I mentioned, ensuring that they meet that minimum eligibility requirement. And then similarly, identify the CS programs that might also be appropriate for that member. We'll also cross-reference on our end eligible services for the member. So don't sweat it too much if you're missing something, or if you think the member might be eligible for community support, but you're not too sure. It is okay to check that box, and we will confirm on our end. And then similar to our plan partners, we have a no wrong door approach. So you can submit those referrals to our calaimreferrals@anthem.com. If you are a contracted provider, you have access to our availability, and you can submit there. You can fax those, or you can call our, as I mentioned, customer care center. I also do just want to flag the housing deposits community support, because we do know that is such a need in the community. And that does not require that an individual for Anthem was enrolled in housing transition navigation. It just does require a housing plan. So if you're working at a navigation center, or you're working with a family that is just in need of that kind of limited intervention support, that could be a great option. And again, for a lot of those community support services, you can encourage the member to call and self-refer, and someone from our team will help navigate. Great, and I think that's it for Anthem.
Thanks, Rebecca. So I'm going to hand it back over to Kristen to talk through Kaiser's process.
Great, thank you very much. So what you'll see up is how you can submit referrals for Kaiser Permanente's ECM or community supports. Most of what you've already heard applies to Kaiser as well, so I don't want to repeat a lot of that, but we'll just highlight a few things. Similar to our plan partners, there's no wrong door. So you can access referrals. I put a link, so you'll have that when you get the slides, but you can Google same as our plan partners. So you can have access to the forms. Similar to our partners, we've made things as simple as possible. And, we will even accept our plan partner forms. So ideally you'll use KP forms, but if you don't have that, or if you're not sure, we can accept another form from another Medi-Cal plan. And again, similar to our partners, you can phone or email in the forms. The email address is posted here, as is the phone number. So feel free to reach out. I think my colleague Jaylyn has posted a link in the chat. So thanks, Jaylyn. You can go to the next slide. I do want to share, and I had started off earlier and mentioned the network lead entities. So that is unique to Kaiser Permanente. This is a very brief overview slide, but just wanted to share. Kaiser has contracted with 3 network lead entities. Centralized service coordination is a key component of what they're bringing. So as of January 1st, Kaiser expanded our direct contract into 27 additional counties. So as of January, we are now in 32 counties. And so the network lead entities are helping to ensure coverage for ECM and community supports and community health workers in all 32 counties. So it's a model that allows us to make sure that we are in each of those communities. So it gives us a comprehensive network, and it lets us also make sure that we're able to work with the community-based organizations. So those 3 entities are getting up and going. I know that they're growing as quickly as possible, and so hopefully if you have questions or if you need to connect with a network lead entity, if you'll go to the next slide, we did want to share those details with you. So the 3 that we are contracted with are Full Circle Health Network, Independent Living Systems, and Partners in Care Foundation. So their contact information is here. Please feel free to email them, reach out to them. They're helping grow the network. So as they're also offering services, they are helping contract with others who are offering services. So ideally, as the network grows, if you're not connected, as we mentioned earlier, that Chris called out, and all the plan partners are hoping to increase the network. And specific for KP, these 3 entities will be the way that we are able to do that. I think that's it for KP slides.
Yeah, thanks, Kristen.
There you go.
Yeah, thanks, Kristen. And actually, we're coming up to the end of our slides too, so make sure you get questions in. We obviously will have plenty of time, and we'll obviously, we can wrap up as soon as folks are done, but we have lots and lots of time for questions, which I'm really glad about. So just wanted to, this last slide just has information about contacting each of the plans if you have questions or to access care and benefits. Obviously, we've talked about the sort of referral process and how to access, help folks access ECM and community supports, but just in general, to access care and benefits, each of the plans has provided their information here as well. I also just want you all to know that the slides have speaker contact information, and really, this is going to sound like we're ending right now, which we're not, but I do really want to thank Andrew and Rebecca and Kristen for being on to share about the specifics of each of your plans, and also to be available to answer questions, which we'll get to in just one sec. I also just want to share And we'll double check. There's been a couple of links shared in the chat, so we'll double check that those links are also in these slides. And if not, we'll add them before we send the slides around. But there's a couple different pages of resources for more information on a lot of what we've talked about. So I mentioned that Homebase has a variety of resources that we put together that are were developed specifically for COCs and COC providers to kind of break down and explain some of a little bit more detail than what we covered today, some of the basics of CalAIM and the ECM and community supports, including some resources that dive a little bit deeper on the housing related community supports in particular. But as Chris mentioned, and we put in the Slack, that DHCS also has policy guides and other information on ECM and community supports too. So there's a lot of information out there to pretty quickly access the details of what each of these benefits and services cover and how to get connected to them. And then we also have, I did mention too, and I know there's a question in the chat that we'll circle back to that relates to Medi-Cal generally, but the Medi-Cal resources, the Medi-Cal renewal resource page, it's referred to as renewals, and there was a reason for that, but it's also just like generally got a ton of information that's hopefully really accessible and easy to understand to make sure that folks you're working with are connected to Medi-Cal in the first place, enrolled in Medi-Cal, and like stay enrolled so that they can access all these services and benefits we've been talking about. And then there's one more slide that has where each of the plans has shared some specific resources that relate to them. So this will be in the slide deck that we send around as well. So that is the content that we wanted to provide. So again, we have a lot of time for questions. Oh, sorry. Well, I didn't mean to stop sharing, but that actually works out pretty well because we were at the question and answer portion anyway. So nice to see some boxes instead of just the word questions on the slide. So yeah, we have time now for questions. So I know we had one question earlier. If you have other questions, you can put them in the chat. You can raise your hand. We can call on folks. I will presume that most questions will be for our managed care plan partners, which is great, but we can also answer questions for us as well. I think I'm going to turn it actually to Carla over to moderate the Q&A so we can make sure we cover everything. So again, if you haven't already put your questions in the chat, feel free, or you can raise your hand and we'll make sure we call on you when we get to you.
Thanks, Jillian. So let's start with Annette's question first, since they had asked previously. So if somebody's receiving medical bills from going to the emergency room, can the past bill of that emergency room visit essentially be covered once the person has been approved for Medi-Cal, if that happened while they were waiting to be approved? I believe the answer is yes. But
yeah, wait, so the question is they went to the emergency room and received services in the emergency room and only later on actually enrolled in Medi-Cal. Is that the question? And that if you want to come off and share, you're welcome to, but you don't have to.
Yes, that's the question she asked. She wanted to know if it would be able to cover those past bills because it's kind of like a burden for her.
Yeah, I actually don't know do our MCP partners know? I don't know the answer to that. If we don't have the answer for you, we can certainly get it and we can follow up. But Rebecca,
okay. You're coming off a specific answer to that. But I would just say, like, if someone is experiencing something like that, definitely to utilize the customer service line immediately, because they would definitely be able to get you to that answer or guide you to it.
Okay.
Yeah, there is. Now this doesn't feel like exactly what your question is, or the question that you were sharing was, but there is something called accelerated enrollment, and there's also something called that like helps folks go through the process of getting enrolled in Medi-Cal more quickly if they're not already. But I think that's a little bit, and that might still be relevant to you, but I think that is different about whether like services that were provided before someone enrolled in Medi-Cal can be reimbursed. So we'll have to look that up and like get back to you on that. Unless one of the other.
I guess she was at the emergency room and in the process got the application while she was there to be, but in the process she didn't have any, so that's what she's stressing about her bill.
Yeah,
but
very understandable. Okay, thanks, Annette.
You call customer service, right?
Yeah, that is what Andrew recommended for sure.
I would recommend she also call her eligibility worker at Medi-Cal.
I think she's working now, because that was the other question she had. Let's see. I know she was I said Do you have any questions? Because I was going to be in this training, and I said, well, now I could ask. But do Medi-Cal only cover some part depending on how much I'm making, samples, applying for, well, she's applying for her children and herself. So, well, she did apply, but she now got a job, and will it still cover her doctor bill? Because she didn't have it when she went to the emergency room. But now she's getting her life together. She's has a job now, and she just wants to know if it's going to be covered. So I guess.
Yeah, I think
she would have
Lorena's.
to call
Oh,
the past-
sorry, Annette.
I guess she would have to call the past worker that assisted her on that, right?
Yes, the eligibility workers, because Medi-Cal does do 3 months retroactive from the day you apply, but you need to be working with your eligibility worker because they do have to confirm your income on those 3 months. So there's a bunch of paperwork and stuff she's going to have to work with for her eligibility worker to do that.
Okay.
So, and because their incomes are different in different months. So eligibility worker, anytime it's a question like that, always check with the eligibility worker at SSA.
Okay. Thank you.
Thanks so much, Lorena. I appreciate that.
Yeah, thank you so much. It does, because Medi-Cal can get so complicated too, that and different situations are so different, and it's hard to know all the details about folks' case. Definitely recommend reaching out to whoever that person is working with for those kinds of questions. Lorena also asked in the chat, who do we call if a health plan member is already participating in ECM? Are there consent forms the member can sign to allow agencies that may be navigating can submit with the member? So I'm guessing, Lorena, that you're referring to like allowing, maybe you or somebody else who's working with the member to have access to that information. Is that
Yes.
Okay.
Yeah. So where can we call to find out if somebody's already getting a ECM support? And then if they are getting the ECM support from the health plans, what are the release of information forms for each of the health plans so that those that are navigating can work with the member to fill that in and then be able to fax it in or scan it over to you all.
So I can jump in on this one. So for our ECM providers, we contract community-based organizations to do our enhanced care management. So it would be connecting with them and figuring out their request for putting together an ROI with that organization. But we have acknowledged that the inability to see who is and isn't currently enrolled in these CalAIM community supports can be confusing and a barrier for care coordination. So we're working really closely with OSH to see how we can integrate these types of programs into HMIS, so there's more visibility about who from the CalAIM provider network is working with these clients. I'm open to feedback from the other plans, but right now I think the workaround would calling the care center with the client to see if they're currently enrolled, and then they should be able to provide you with the provider that the individual is connected with. Did that answer your question, Lorena?
It sounds like it's a challenge. So you can't call the health plan, and in the member services line, they're able to identify if somebody is in the program. Can they or can they? Because we could do that with the member at our site.
Yeah, they can let you know that they're enrolled in the program and then what provider they're working with. But exactly.
So we start with member services.
You do start with member services.
And then they would refer us to the agency that you're contracted with. Then we'd have to call them and get the ROIs or release of information from them to be able to coordinate with them. Correct?
Yeah, and that's what the current workflow looks like. But again, it has been flagged as a barrier for you all to be doing like meaningful care coordination.
I just put in the chat, great idea if you could integrate, ECM status into HMIS. That would make it'd make it easier for a lot of people.
For sure.
Thanks, Rebecca. Andrew or Kristen, did you want to add anything to what Rebecca shared?
Yeah, I would just highlight that it would be a similar process. You would want to call the customer care line, and then get more information about which provider they've been assigned to, and then they can help you to get in contact with that provider. So it would be similar. And then just also echoing what Rebecca has mentioned, and sort of recognizing and understanding, that the ways for you guys to all be able to communicate best would be, if we did have it in HMAS. So very much noted.
And same, exactly the same. Yeah.
Thanks so much, y'all. We also had a question in the chat, and I think Andrew did post a flyer, but someone asked if the health plans do have like PDF flyers to give to their clients, just talking about the different programs that we covered today. So just wanted to raise that too in case you all did and wanted to share.
Yeah, absolutely. So on the PowerPoint that Jillian will be sending out, we linked our PDF flyers for both ECM and community supports. And then I'll also drop in the chat again our CalAIM kind of resource and referral page, which is going to have a lot of the forms and kind of FAQ sheets that you would want to share with clients or reference yourself. There's a whole slew of benefits and services outside of the CalAIM world as well. So this is a good starting point to see how to get your members connected to the plan.
And for KP, we'll make sure that you have access to those, and we'll send them through Jillian so she can include it when she sends out the links.
Thanks, y'all. And I just wanted to add before Carly go to the next question, I did not check with any of the MCPs before saying what I'm about to say, but I don't think any of them will disagree that if, as you're looking through the resources they already have, if there are, I think we all do our best to put together resources for folks at different levels and places. So like resources that providers can understand, resources that folks experiencing homelessness can reference to understand like what's available to them. And sometimes like we need to hear from you all, like what's actually working well and what other resources are needed. So if as you're working to understand yourselves and also to help your clients understand what these resources are and what they're eligible for and how to get connected to them, if there are things that are missing, like types of flyers that cover certain types of information, or you're like, these resources have so much, we need these broken down into like, this flyer needs to be 10 different flyers, like any insight that you all can provide, I'm sure that they can shake their heads at me if they would like to, but I would be surprised if they're disagreeing. I think that would be really useful information for the health plans to know. And so, and I know the health plans are all working directly with the CoC really closely in Santa Clara County. So that information can get shared to the plans. I think that would be really valuable as well.
Thanks, Jillian. Jim wrote in the chat that they work with clients who were homeless at one time, but now maybe were housed in permanent housing, but are still in danger of going back to homelessness due to different challenges. And so if these clients are receiving Medi-Cal, are they still able to apply for the ECM resources?
I see Kristen unmuting. She's been here longer than me, so please jump in if I'm saying anything incorrect. So they might not be eligible for the ECM homeless population of focus, but it doesn't mean they're not going to fall into a different population of focus. So I would reference that ECM referral form and see if they fall into any of those additional categories. But for community supports, if they are at risk, and again, they have that like behavioral or they have that additional need, they're going to meet the criteria. So especially if it's somebody is kind of experiencing some housing instability, I would really encourage you to start by filling out a community supports referral form and seeing if you can connect them to that housing trio.
Beautifully said.
Thumbs up all around from the other health plans for anyone. I don't know whether Zoom emoji responses show up when you're watching your recording. So just in case, both other health plans gave thumbs up during that response.
Thank you. Someone also sent me a direct message with a question and said, I know Santa Clara Family Health Plan or Anthem will cover for non-emergency medical transportation, and I wonder if they would cover transportation for a housing interview when a person has a disability and needs assistance. Is that a something that the plans cover?
I do not have an answer for that one, but as we're looking at social determinants of health and housing as health, I think it's something that we can take back internally, and I can circle back with an answer on that.
Yeah, I don't believe that would be covered generally. So if you're on our website, and you could even just type in transportation services SCFHP in Google, and then it'll list that it's for non-medical transportation is for traveling to and from medical appointment or picking up prescriptions and medical supplies. So that would be what is covered under the non-emergency station. But shameless plug out there, we do have transportation services. It doesn't cover everything, but it is a underutilized benefit. So make sure to definitely look into that for your members.
It's also, I don't know if that question was coming from someone who is a community supports provider, for example, or an ECM provider, and is wondering if that would be covered under their contract, or if it's someone who's just wondering if they can help a client connect to something. But I would also just encourage you to, if someone is enrolled with an ECM or community supports, to ask that question to their ECM or community supports provider, because even if it's not covered under the provision of ECM or the provision of community supports, like that provider might be able to still provide that service. So I would also ask the question of the provider, specifically the ECM or community supports provider that might be working with folks who are needing those rides.
All right, thank you. And then another question we received was, would a case manager, and they clarified, like, what about a case manager who's not an ECM case manager, be able to fill out an ECM referral form with their clients to turn into their corresponding plan, or would this form be filled out by their doctor or their primary care physician?
Or could you repeat the beginning portion of the question? I just want to make sure I heard it correctly.
Yeah, so a case manager, so I'm assuming like maybe someone, let's say, who's in a homeless service agency, so not an ECM case manager. Would a case manager be able to fill out an ECM referral form with their clients and then turn that into their the member's plan? Or does the person filling out the form have to be a doctor or a primary care physician?
So
I have to follow up on that one.
I'll jump in for KP. There's the no wrong door. So if a case manager fills out the form and turns it in, that's totally fine.
Same for Anthem. Yeah, definitely. We can have the homeless service provider complete that.
And this is Chris with Anthem. I'll just say that the state DHCS recently released a brief, like a spotlight brief type thing on enhanced care management. And one of the things they really highlighted was that the state's expecting that the majority of referrals for ECM are going to come through community partners, right? And those are going to be local homeless organizations, street outreach providers, shelter providers, permanent supportive housing providers, right? That the state, again, expecting that the majority of referrals for ECM will come through non-contracted, CalEM providers that are operating homeless services. So like 100% yes, like please make referrals.
Thanks, Chris. And I think, Chris, if the spotlight you're talking about is the resource that's like the spotlight for folks experiencing homelessness, that is linked in the resource in the slides we'll send, so you'll be able to access the spotlight resource that Chris was talking about.
And I'll just tag on to that. We're so appreciative to have this space to kind of give a high level overview of, managed care and these programs. But if you feel like you could really benefit from a referral training specific for your organization, our contact information is in the slide. Don't hesitate to reach out. We're happy to provide additional training with your staff.
And it
Yeah,
might not
definitely,
show up in
from
the,
Santa Clara Family Health Plan, just to echo that as well. Any other like resources that we can provide or in-depth trainings, one-on-one with organizations, definitely let us know.
and same for KP. I feel like I'm saying same a lot, but
That's that's not always the case in every county. Sometimes the health plans are not all on the same page. So I think the more that you all say same, the better I feel for folks that are helping to navigate these. So
fantastic.
And then someone asked
I
in the
also
chat.
wanted to highlight one quick benefit really quickly that we have, or one of the quick services that we have is we have this HFI program, Healthcare Financially, and so it's a ability for our Medi-Cal members to help apply for benefits like such as federal benefits, SSI, Social Security, and other income resources to help improve their basic needs. So this is just one of the really cool benefits that you could find by looking through our website. And so I know especially for folks working in the homeless services, that this is definitely something that could help someone be on track to being able to secure housing, is making sure that they have income. So definitely look up different things like that on our website.
Thanks so much, Andrew. Someone also was asking for clarification in the chat about eligibility criteria for community supports. So they asked, just to clarify, so the only requirements that a person needs is to have Medi-Cal and be connected to an MCP in order to be able to receive community support services, or are there other eligibility requirements that go with that?
There are eligibility requirements specific to each community supports. So, I encourage you to, and the plans are aligned with that criteria. So I encourage you to check out that referral form. And again, I know we highlighted a couple that are specific to the, individuals experiencing homelessness, but there's so many resources through the community supports that your client might also benefit from and be eligible for. And I see Kristen's given the thumbs up, so that's her ditto. Yeah.
yeah, I know in addition to the resources that are on the each of the health plans pages, I know I mentioned this before, but just to reiterate, there are DHCS resources, like their community supports policy guide goes into a lot of detail about each community support if you just want more details about any of them, including things like eligibility. And I mentioned, I'm sure I've mentioned this before, that one of the resources we have on our website too that we link in the slides is a specific resource that covers not all 6. Everyone refers to the housing related community supports as a slightly different size package, but the 4 that we consider to be like the most directly related to housing, we have a resource that goes into the services covered and eligibility requirements and some of the limitations and things too. So there's like, depending on what kinds of resources you most like, you're able to process the best or you find the most useful, there's a couple different places you can go to find, like refer back to for more details.
Thanks, Jillian. Does anyone have any other questions?
Yeah, Annette just asked, Andrew, this might be for you. Annette just said, I saw in an email that HFI is out of funds.
Yeah, I can't speak to that specific email, but I will say that, we just highlighted it again at our all staff meeting. And so it is definitely something that our organization is really happy to provide, and we still are contracting with HFI.
And if there aren't additional questions, I would just like to, one last time kind of make a plug regarding, our desire to expand the provider network. So if you're on this call and you're thinking, well, I don't necessarily need to refer them for transition navigation or housing search because I'm the provider doing that work, we really are trying to engage more local community-based organizations to become CalAIM providers. There's a really great resource that came out through the Corporation of Supportive Housing. They did a Medi-Cal Academy for homeless service providers that kind of really demystifies what it is to become a CalAIM contracted provider. So if it's something that you're starting to think about now after this call and you'd like a little bit more information, I will also drop that in the chat.
Yeah, thanks, Rebecca. We can put that in the slides as well to make sure folks have that too.
Thank you. Any other questions? Please feel free to come off mute. Raise your Zoom hand, pop it in the chat. And Rebecca just popped in that Medi-Cal Academy link for homeless service providers. Were you going to say something, Jillian?
Yes, sorry, I just realized I was muted. While we're giving folks a few more minutes, as Carla mentioned, to see if you have any more questions for any of our health plans, I'll just request that if you don't have any questions, if you just stick around for a sec, we have a just very brief via Zoom poll feedback form for this training, but also, again, we have some time if people do questions occur to you, but while we're giving you a little bit of time for that, I just want to thank again, Andrew and Chris and Rebecca and Jalen and Chris from all the health plans for coming on and sharing your specific health plan information and process with us. Thank you all for joining us for the training. Hopefully you found it really helpful. We will follow up with the recording link and also the slides that have what we're going to update it with a few other resources that came up during this to make sure you have links to everything that was provided via the chat. So just wanted to thank you all so much, and thanks Carla and Sadika as well. But yeah, if there's still time, if people have questions, I just wanted to, in case anyone needs to jump off and you don't have questions, just wanted to say our thanks to everyone too.
I can't find raise my hand.
Oh, that's okay. Go ahead, Annette.
But I have a question. Okay, so I work with a different population, but we have had clients come in that are homeless or at risk of becoming homeless. So I've, referred them to Here for You and did the best I could with that. But we also get clients referrals that don't have Medi-Cal. So somebody asked earlier about that referral sheet that you included in the chat. Like I work at KidScope and we get referrals from the Kid Connection there. And some of the clients they're coming to us for their child to be assessed. But in talking to the parent and all, we find out that there's more services needed. And it's hard for them to focus on their child with their doctor's appointments when they're too worried about where they're going to go sleep the next night, or, if they're going to be safe in their car. So that sheet, somebody asked earlier, can we fill it out? I don't work with the homeless program, but we have been getting clients like that fit that population. So can we still fill out that form, that referral form? I know somebody said yes, but they said, okay, so it's a yes. Thank you.
I do just want to, Annette, because of one thing you said, I just want to clarify. If you're talking about folks that are not actually enrolled in Medi-Cal yet, they would need to get enrolled in Medi-Cal before they can be referred to ECM or community supports.
Hmm.
So,
okay.
So I just want to clarify that too. And then once that has happened, anyone can fill out that form to help refer them to ECM or community supports.
All right.
Yeah. And I'm again, it's in the slides, but I'm going to put it in the chat too. Again, this is a toolkit that Homebase put together specifically for CoC providers. I know you're saying you're not specifically a homeless service provider, but it would still be relevant. But it's meant to help folks experiencing homelessness stay on Medi-Cal. So it's phrased like renewals for people that are already on Medi-Cal, but it also has information just about helping to connect people to Medi-Cal in the first place. So to the extent that's a need of yours or anyone to just check whether someone's on Medi-Cal, there's information about how to do that. And if they're not, there's information on how to get them enrolled in Medi-Cal. So I just wanted to mention that in response to your question too, and make sure folks are aware of that resource as well.
Oh, that's perfect. Thank you. Thank you so much.
Well, thank you. It looks like we got a pretty good number of folks that filled out the feedback survey. I can leave it open for a little bit longer, just in case you're still filling it out, we really appreciate your feedback. It helps us improve trainings, and definitely going to bring back trainings like this year after year. So please let us know how it can be more helpful or better in the future. But yeah, thank you all so much for the health plans, for being here, for Jillian, Sadaka, thank you so much. And all of you for attending too.
Thanks for having us.
Thank you.
Thank you all.
Thanks, y'all. Take care.